Conan Mustain. I'm a general and colorectal surgeon at UAMS. Hemorrhoids are a normal part of our anatomy. I'm always surprised at how many of my patients look at me in shock when I tell them that. Hemorrhoids are sort of enlarged blood vessels around the anus, just inside the anus, that actually contribute about 10 to 15% to your continence or your ability to hold your bowel movements in. So everybody's supposed to have hemorrhoids, and they serve a purpose. When pressure inside your abdomen and your pelvis increases, the pressure in those blood vessels can increase and they can swell. That can happen from patients that do a lot of heavy lifting and straining. It can happen from spending a lot of time on the toilet straining to have a bowel movement. The connective tissue within the hemorrhoids gets loose, they swell with blood, and they can cause a range of symptoms. There's sort of two classic groups that I see for hemorrhoids. Some patients will have what's called an acute thrombosed external hemorrhoid. This is sort of a painful, almost like a marble that shows up in someone's anus. A lot of times patients report that they were working hard in the yard or they were doing something strenuous and that something popped up and became very tender. These will typically get better on their own within a couple of days. If patients show up within the first 48 hours with a large, painful, acutely thrombosed hemorrhoid, we may do a minor procedure in the office to actually excise the hemorrhoid and remove the clotted blood that's in it. But oftentimes, if they're within several days of it coming on, it will just continue to get better with just observation and conservative management. The other group that I see frequently for hemorrhoids are patients that have large internal hemorrhoids, and by that I mean inside the anal canal and sort of above the level in which patients can sense pain or discomfort in their anus. And those patients typically present with painless bleeding. Patients will sit down to have a bowel movement and they'll notice that the whole bowl is red or that there's blood dripping out after they have a bowel movement. These hemorrhoids are seen only through a special instrument that we use in our office called an anoscope, and they can be treated a variety of ways. Again, the mainstay of most treatments for hemorrhoids is increasing your fiber intake, increasing your water intake, and avoiding straining. There are a number of office-based treatments that we can do for hemorrhoids, particularly internal hemorrhoids, such as placing rubber bands on them in the office, which is a relatively painless procedure that will sort of strangle the hemorrhoid and allow it to fall off in a couple of days and scar. And rarely, patients with extremely large hemorrhoids that have symptoms that don't get better with conservative treatment may require surgery. Every patient we treat at UAMS is an individual, and every condition is distinct for that particular patient. Obviously, patients fall into broad categories: colon cancer, rectal cancer, diverticulitis, but each case is different. And I think the judgment is probably my judgment I think is as important as my surgical skill in taking care of those patients. There are a number of different options for just about every condition that we treat, and it requires careful thought and attention to detail in order to determine the right treatment for the right patient.